During 2019, the Ministry of Public Health has put in place the necessary facilities in an effort to roll out effective healthcare services across the country. On this InfoHubIn-Depth, we take a look at some of the projects and services taken to a number of regions throughout 2019 to ensure Guyanese get the medical attention they need.
Are you ready to embark on a truly epic adventure to an undiscovered corner of South America, where some of the most spectacular natural attractions are unveiled within a beautifully diverse landscape? From the wetlands and savannas to the ancient mountains, magnificent waterways and lush enriching rainforest would provide a vast playground for some of the most exotic and breathtaking creatures on the planet, including many of the world's giant species. This untouched land of mystery and wonder serves up an exclusive experience for travelers. So are you ready for a new, awe-inspiring adventure? Welcome back to nature. Welcome to Guyana.
Women between the ages of 29 to 49 years in Region 2 now have easier access to healthcare services. Chief among them is the Visual Inspection with Acetic Acid VIA clinic at the Regina Health Center. This is a much-needed service within the region. Coordinator of the VIA program at the Ministry of Public Health, Dr. Martin Campbell, said this service is part of the ministry's cervical cancer prevention strategy.
Cervical cancer, unlike many other types of cancers, affords us a golden opportunity for prevention. Its generally slow progressing nature and proven cause, the human papillomavirus, makes cervical cancer almost 100% preventable through vaccinations for HPV and effective screening for early detection. Out of thousands of women that are eligible for VIA, only a handful, meager 250, access VIA screening in the region every year. It is envisioned that the Regina VIA clinic, with its central location, accessibility, and competent, enthusiastic staff, will become the principal site of access to VIA, providing quality and client-centered services to women.
Public Health Minister the Honorable Valdo Lawrence, who commissioned the clinic, highlighted the importance of the VIA clinic.
In concrete terms, we are targeting some 5,735 women. Remember that number. Because even as we scoff at someone, we don't know what is happening with our bodies. Isn't that awesome? We are not doing things from the Ministry of Public Health in abstract. We know what we're working with. We're working to find that approximately 6,000 women. And it's not just any woman. We're looking for those women 25 to 49 in your region.
Over in Region 6, several new projects were commissioned in April of this year, while others were retrofitted, refurbished, and recommissioned. Firstly, 2 health centers were commissioned at Pletanka on the east bank of Berbice and number 76 village on the Quarantine Coast. Here are 2 residents of the East Bank Berbice who were grateful for having such a facility in the area.
Shortly, I get a health center here, I come to visit the doctors, and no complaint. The doctor was very, very thankful. I have good treatment, also the nurse. Nearly a month, every day. I come for a dressing. I never expect one thing like this to happen because to travel from Wegland to get Amsterdam is not easy. You gotta wake up 11 o'clock in the morning to get to Amsterdam. And now wake up early morning, make my tea, look after my cattle, and come to the health center.
With this health center here, this will reduce the amount of persons traveling the road from as far as Cape Mood and Mara till to Brothers to New Amsterdam to receive medical attention. And I'm sure that the government has looked into the situation see that we are in need of a health center. And today, this is the result. We have a health center, it's functional, we have very friendly staff.
Director of Health Services in the region, Jevon Stephen, noted that the $14 million health center at Pletanka is located just about 18 miles from the town of New Amsterdam. Meanwhile, the $15 million center at number 76 Village come as a convenience for more than 4,000 residents of surrounding villages who no longer have to worry about traveling long distances for the service. Other facilities commissioned to improve services in the region include the commissioning of a state-of-the-art digital lab at the Skeldon District Hospital, refurbishing of the pediatric ward, commissioning of a radiology department both at the Port Morant District Hospital. The National Ophthalmology Hospital was also recommissioned and a series of eye surgeries were conducted. A new and spacious dental unit, a doctor's quarters, and a medical laboratory and a remodeled kitchen were also part of the package at the New Amsterdam Hospital. Still in Region 6, a modern multi-million-dollar nurses' quarters was also commissioned. Student nurses who came from as far as Region 9 or communities in the Berbice and Corentyne rivers, even way up the Corentyne coast, can now be housed in a living space constructed specifically for them. These quarters are located in the compound of the New Amsterdam School of Nursing.
I have been blessed with the opportunity to study at the New Amsterdam School of Nursing and have benefited greatly from the newly constructed hostel. These benefits include adequate water supply, electricity, my room is comfortable and self-contained, and furnished to meet my needs. I love the fact that the hostel is located within the school compound. It has reduced my expenses since I do not have to pay to travel every day to school. At the hostel, I'm able to study in groups with my fellow colleagues.
Being a resident student at the New Amsterdam School of Nursing, to express my profound appreciation to our government and regional authorities. Firstly, for the training opportunity towards becoming a trained registered nurse. Secondly, and perhaps most importantly, for providing me with accommodation at this sparkling new nurses' dormitory. Coming all the way from Corriverton, I am able to save the cost of traveling and to study in comfort, providing with 24-hour security service.
Senior nursing tutor at the school, Sister Oslin Hicken-Paul, said that based on her assessment, there have been positive changes since nurses are now housed closer to school.
Now, having our students within the school compound is very beneficial in that the students are punctual for classroom session. There is a reduction in absenteeism. There is also a reduction in the financial burden on our students. There is extended interaction time for the students and the lecturers. Because they do not have to travel far distances, we can go a little beyond our call and be there for them.
Outside of Region 6, other infrastructure commissioned include the new wing of the Material Management Unit at Diamond for the effective storage of drugs and medical supplies. This has allowed for the ministry to boast of an above 90% stock level. Soon after that, the Central Supplies Unit in Kingston was also commissioned, serving as a modernized storage bond for the Ministry of Public Health and its facilities.
When we got into office in 2015, we were confronted with a situation where we had to find a bond and find a bond quickly. So we were using, for one of the locations, in fact, a bond belonging to the new GPC, a private outfit. And we were informed that the proprietors wanted their bond back. So this story of the Kingston bond, if I may call it that, is a story that sounds like a miracle because we wanted to move from the restricted areas we had, and the Ministry of Health in some way was like a squatters village at one point. They have a building here, they got one half a mile away, they got one another quarter mile away, in several places, that if we could have consolidated venue and location for the ministry, it will give you greater scope for economy of space resources, and everything else that will come to the efficient and effective management of the public health system.
Anai in Region 9 has near its health center a maternity waiting home. Commissioned as the Yvonne Jacobus Maternity Waiting Home, the building will strategically serve expectant mothers in the North Rupununi district, housing 7 mothers at a time.
We recognize also that coupled with all of those medical things that has been happening is that of access to health services. Access. If we put a health center in a place where our women have to walk for miles or go on an ATV or on a bicycle, then we ain't doing nothing. All we are doing is helping to push her over the brink. It means that we are not doing what we are supposed to do.
The waiting home was named after a resident of Arnaputa, Yvonne Janet Jacobus, a midwife who has served the people of the North Rupununi for over 50 years. Her work in the area of nursing and midwifery is testament to the vision being fulfilled of ensuring Indigenous women have a fair chance at pre- and postnatal care and safe deliveries.
There has been specific focus on ensuring emergency cases in riverine and far-flung communities are transported in a timely manner. Water ambulances have been procured, equipped and handed over to Oriala, Bartica communities in the Upper Berbice River and Baracara in the Kanji River.
Region 6 benefited from its second water ambulance, this one being commissioned for the Baracara village up the Kanji River. Last year, the region's first water ambulance was commissioned for Oriala in the Quarantine River. Community health worker Kevon Joseph, attached to the Baracara Health Center, explained that the ambulance will make a significant difference in how emergency cases are attended.
Late at night, we have to take out patients who have trauma, persons with fast heart rates, and persons with laceration. And we have a lot of difficulties in the river because sometimes there are grass in the river that causes blockage. Well, I am overwhelmed. I'm excited because it will be access, better health care to the community. Persons will be able to go there very fast to access to New Amsterdam Hospital.
Bartica also received a newly commissioned water ambulance. The emergency water transport was handed over to the town by the Minister of Public Health, Walter Lawrence. It was built by local contractor Sunrise Marine Incorporated, valued approximately $11 million. The water ambulance is equipped with all that is needed for its use in the effective delivery of healthcare services in the riverine region.
While this is a tremendous step for the people and the health sector in Region 7, that this will not only benefit Region 7, but it will benefit Region 3, Region 10, and also Region 2. And so I want to say kudos. Kudos to all taxpayers who made this possible.
According to Regional Chairman Gordon Bradford, the need for the water ambulance was cited since 2006. However, priority was never given by the previous administration.
We have been back and forth with this project, and this started since around 2006. We visualized that we needed a river ambulance. This will not only serve Bartica, but even the nearby riverine communities.
It was also noted that the operation of the water ambulance will eliminate the need for the region to contract and rent boats, as was the norm for many years. Healthcare in Region 10 has received a further boost with the handing over of a $16 million water ambulance to the Regional Democratic Council. The boat complements a much smaller boat for health in the region and caters to the emergency needs of persons in riverine areas along the Berbice River. Regional Health Officer Region 10, Dr. Pansy Armstrong. 2 new ambulances have also been officially handed over to the Regional Health Officers of Essequibo Islands, West Demerara Region 3 and Demerara Mahaika Region 4. The vehicles were purchased with funding from a $1.6 billion Inter-American Development Bank loan. Regional Health Officer of Region 3, Dr. Serdal Makwat, and Dr. Quincy Jones of Region 4 both said the acquisition is critical to the improved level of healthcare delivery for expectant mothers and their babies.
We'd received initially both an engine that will serve the Santa Mission area and the San Hills area, that's in the Demerara River, and this is the second phase where we received now a spanking new vehicle which will aid in the maternal and child health program and the region as a whole.
I could safely say for Region 4, this is the first time we have such an ambulance that is comprehensively equipped with all the necessary needed for the transit of an emergency patient. This will be coupled with the upgrade of the C.C. Nicholson Hospital into a maternal institution, where low-risk mothers will be able to deliver at the hospital.
Another ambulance procured under this same loan was given to Anai in the North Rupununi. Minister Lawrence stressed that the ministry has been given the mandate to ensure all Guyanese have adequate access to health care. Such an initiative will start in Region 1 soon.
Because the Maruka passage, the traveling is so hard, that is the first place we are going to give the ambulance to. Because we know how they suffer with that river going out that creek there. So we're going to give them that first ambulance for this region. And then we're going to be buying another ambulance which will go to the Port Kaituma end that can be able to work between Port Kaituma and Mabaruma. And then the third ambulance will be bought for Mabaruma.
There is a constant push by the Public Health Ministry to create access to health care in all regions. A regular feature during 2019 and even before was the specialized medical and surgical outreaches which were taken to several hinterland regions.
The Ministry of Public Health is going even further in its efforts to ensure residents in far-flung communities access specialized services. Worthy of note were Waipa, Karasparu, Oriala, Siparuta, and Kamarang, among many other villages which had specialized outreaches after these services were unavailable for several years. The Mabaruma Regional Hospital also hosted surgical outreaches for persons from all across the region.
It's not the first time, and this is the third and fourth, one thing for my foot to bone. So I'm scared of nothing. I try to get this thing done long before now. I got a study. The doctor didn't tell me the operation theater now work, and other people going to pay the money and get it done.
At one time, one of the testicle one side, the more big, right? And I never take it serious. But it's about, let me say, half of this year now, he began to come down. He said, well, me got to take a surgery, and he had me in a clinic, and I was very happy about it.
Types of surgeries done include hernia repairs, tubal ligations, and orthopedic procedures. The Ministry of Public Health has taken note of the high cost incurred to transport a patient or patients for surgery to Georgetown.
We ask our doctors here to enlist patients that need surgeries because we don't want them to travel to Georgetown or for us to be doing medvacs all the time, and it's incurring a high cost at the Ministry of Public Health.
Residents of Oriala and Siparuta noted how costly it is to travel to Skeldon, Port Morant, or even New Amsterdam for healthcare.
Well, it's really helpful because the outreach that came to Oriala, we don't really have it often, and we have a lot of sickness, like the extraction of tooth is one, the blood pressure. So sometimes when the hospital is not working, sometimes they have to work, the doctors and the health workers have to go out. So we don't face a great disadvantage at that area.
It is very beneficial because it's due to the poverty. People don't have money to really pay for these things out on the coast. So it is a very valuable services. So it should be done regularly.
So I believe that the government is a fair government, looking all over the country, each and every Amerindian village. This is the last Amerindian village in Guyana, and I believe that we should be get some more thoughts on us. For a very long time, doctor never come in and do such a things that where we eye tests and whatsoever, all people who sick, and so our council is trying for us, but they are not the government.
So I feel it's good. The health team is here because it would be more easier to do things like this down in our community instead of going straight to Georgetown. Because out there it's much, some of us can't go there and we don't know the place. So when you come here now, it makes it easier for us to do whatever we have to do.
I appreciate the visit of the doctors in Monkey Mountain because this rarely happens out here. And right now I'm here to do a small surgery in my feet, and I'm thankful for that because I was wanting to know if I have to pay a passage to go to Georgetown and look that after, which is very expensive. And
Speaking on behalf of the village of Wiper, Tushawn Norbert Adams explained that the outreach came at the right time.
We was expecting a very good treatment from the doctors, nurses, and whoever it is, because that we haven't seen any doctor or trained nurses or medics or dentists for years ago. And then we need a proper medical care receiving from the team.
Harnessing the nation's human resources, especially for the public health sector, continues and goes beyond the training of doctors and nurses. The ministry within the last year has intensified its training efforts while reintroducing programs giving more persons the opportunity to obtain a profession.
Most training programs were introduced in the form of short courses. The introduction of training for patient care assistants in some regions has attracted more than 250 young men and women from Region 6, 4, and 10. Valedictorian Almanta Thompson, who graduated from the first batch of PCAs in Linden, said her decision to take advantage of the training was a wise move and now recommends that other young people follow her example.
I can now work my way up into being what I've always wanted to be, a medical doctor. This is just the stepping stone. I'm not going to stop here. This is just the door I've opened for me, and I'm going to enter it and continue to pursuing my dream.
Shari DeCambra said before the training she was employed in a restaurant, but working in the medical field was her heart's desire.
It was very challenging at first, but my aim was basically to put my best foot forward and do what was needed at the end of the day. I feel really awesome about this because it gives me a chance to prove myself, to show others what I've learned, help patients, and move up, do better.
Minister Lawrence shared the ministry's outlook on harnessing human resources in this regard.
Human resource for health is a critical area. We can buy all of the fancy equipment and build all the health buildings, but if we don't have the human resources that are trained and equipped to provide the service, it is like throwing water on duck back.
The training of allied health professionals has been reintroduced specifically in 5 areas. This batch of allied health professionals include 43 pharmacy assistants, 30 environmental health assistants, 40 medical laboratory technicians, 22 medical X-ray technicians, and 12 audiological practitioners. The public health minister noted that the government is pleased to provide this opportunity to young people.
This has been InfoHub-In-Depth. Thanks for watching. Goodbye.
Are you ready to embark on a truly epic adventure to an undiscovered corner of South America, where some of the most spectacular natural attractions are unveiled within a beautifully diverse landscape? From the wetlands and savannas to the ancient mountains, magnificent waterways and lush enriching rainforest would provide a vast playground for some of the most exotic and breathtaking creatures on the planet, including many of the world's giant species. This untouched land of mystery and wonder serves up an exclusive experience for travelers. So are you ready for a new, awe-inspiring adventure? Welcome back to nature. Welcome to Guyana.